now we have the president of the Merck Global Innovation Fund, Bill Taranto, who is himself, you can call it a venture unicorn. He's actually helped create some of the big unicorns. One of them we're going to hear about later, or hear from later today, Glenn Tolman, who's going on his 4-time unicorn with his next Transparent venture. But today, right now, we have Bill interviewing and talking to Doron Dinstein, who's a venture partner at Entree Capital. And again, welcome to you both. Thank you for taking your time out today, and appreciate you joining. I'll hand it over to Bill. Bill?
Sure. Thank you very much, Dan. I appreciate it. And Doron, a pleasure to meet. I haven't had a chance to meet you before, but I'll get to know you a bit and based on the questions I'm going to ask. So thank you for joining today. But first, what I want to kind of hear about is a little bit about your journey. You know, I looked at your background. You studied medicine. You got your MBA. Then you went into some leadership positions both at Itamar and Mazor, and then you end up as a venture partner. And I'm just curious, how you got your journey started and from the beginning, and how'd you end up at Entree Capital at the end? What happened in between?
First of all, thanks for having me. It's been a really interesting journey. I have to say that pretty much none of it was planned. I come from a family of lawyers, so I decided to rebel and go to med school, which was the furthest away faculty on the campus at Tel Aviv University. And I was fascinated by the medical knowledge. I loved the interaction with patients, and I hated the medical system. I thought that it was a very equitable system. It was bad for all involved on all sides, and decided that I wanted to complete the whole journey, got my license to practice medicine here in Israel, and decided that it's not for me. I will not be able to change the system, but the system will change me. And at the time, a friend of mine from medical school, his brother, who's brilliant, developed some software. It was really interesting. We're talking about the year 2001, before digital health was a thing. And we tried our luck with a medical startup. So I started out as an entrepreneur, which gives me today, in hindsight, a lot of respect for entrepreneurs, for people who are brave enough to do what I was. I attempted myself. That did not work out, and eventually I joined Itamar Medical. Spent about 5 years plus there. Got my MBA, as you said, and one day was out having hummus at a place not too far away from the office, and met somebody from Mazor Robotics who said, "How about becoming VP marketing?" I said, "Talk to me." Passed the CV to the CEO, and probably they just didn't have enough candidates, but they ended up with me. So that was really interesting. Mazor Robotics ended up being acquired by Medtronic in 2018, December 2018. But so I was there for like 9 years, VP marketing, biz dev, chief medical officer, corporate development. So it was really a pretty wide spectrum of things, and was super interesting. An amazing company with an amazing story, an amazing team, and I just learned so much. And when we were acquired, I stayed on board part-time as the medical director for what was Mazor Robotics at the time, and didn't really know what to do next. So one of the companies here in Israel approached me and asked me if I was willing to do a certain role, and I didn't know. I liked the company, not so much what they were offering me as a role. It didn't really suit my strengths. So I came over to Entree Capital to consult with one of the partners, who's a good friend of mine from the MBA. And he pretty much told me that I'm starting to work at Entree. I was like, okay. And that was that. And to make it even worse, this was over WhatsApp. So we had a meeting and he asked me, so did you take the job? And I said, no. He's like, okay, you're starting to work with us. I wrote back, let's talk about it. And the WhatsApp I got back was, we talked.
That's a great story. Well, fantastic. That's a great journey of getting yourself up to the venture capital world. Sometimes it is fortuitous. My journey is somewhat similar in that respect. But I'd like to understand a little bit about Entree Capital. What are you focusing on? What kind of stage of investments do you do? How do you look at healthcare? And what are you most focused on?
Wow, I wish I knew. So I joined here. They brought me on board officially on March 1st last year, just when COVID hit.
Oh, got it.
And so like 17 days later, Israel went into lockdown. And I can tell you that I've been working on an investment thesis, but being an investor for just over a year, I think would be kind of foolish on my end. We focus on early stage mainly, but not exclusively. So we've done pre-seed and seed. We've done check sizes starting at $150,000, for example, though our usual check sizes are, let's say, 3 million plus minus 2. We've had companies where we sign an agreement with them and they opened a bank account and we transferred $1 million into the account. That was like the first thing that happened to the company. We like things that get us excited over things that I can tell lay people what the company does, and you will get light in the person's eyes without them being doctors. I like things that have impact on patients' lives that are significant. We're pretty much the other limitation, let's say it's geographic. We're pretty much focused on Israel, the Middle East, where we understand the culture. We know how much to discount the hand waving of entrepreneurs. And there is a cultural issue and a language issue sometimes. So not because the conversations aren't in English, the decks are always in English. It's more of a, how do you translate this from like the technology into a product? So I would say that in Israel, you'll find really strong tech, but product-wise, I think that we need the industry to mature more. So I'd say that mainly focusing on early stage and geographically. Otherwise, like if you look at the verticals, we've done since I joined, we're signing tonight the 10th term sheet. And we've done everything from pharma through devices, interference RNA-based treatment to digital health. So it means that we're either schizophrenic or just that I really don't know what I'm doing yet, and shooting in all directions.
No,
but I can stand behind each and every one of the companies, and I love them all. I feel sort of like a proud parent who loves all his kids.
Right, understood. One of the areas I'd like to focus on, if it's okay with you a little bit, is I'll be transparent because that's where I focus, but is the digital health side, just kind of what you're thinking about, how you view digital health as an overall market, maybe what some of the pitfalls might be for the entrepreneurs maybe in the audience or other investors in investing in that type of space.
Wow. So I think that my main problem is that I tend to see a lot of fluff. That because there's so much hype currently in digital health, that it's sometimes hard to tell apart the great teams with a great product from the great storytellers who will not necessarily make it to the market. Now, we got to differentiate between the target audience for the digital health. Are we talking about CDSM, provider-focused systems? Are we talking about the ones that are more patient-oriented, patient-focused? Are we talking about the ones that are more for the enterprise, whether this be a payer, a provider system, or even labs, and obviously pharma? So each one of these, we will look for different qualifications within the team, different go-to-market strategy, that the value proposition needs to be very attuned to a very specific market fit. We're looking for teams that sort of like cracked they hacked into the system, that they know how to get to the right spot with the right offering that would resonate with the market and be a valuable product.
Okay, good. One other question I want to ask you, because this is near and dear to me, is a little bit about HITLab. I've been very fortunate to work with Stan for a while, and he's made me chair of the HITLab, Breakthrough Alliance. And I was curious about your involvement with HITLab. How do you see HITLab potentially enhancing what you're doing as not only an investor, but your overall portfolio?
So first of all, I think that they're doing something great. I mean, not just, I would dare say, even like on a global level, right? We need the education. So when entrepreneurs come over to a fund like Entree Capital, what we see is on a more mature level, that their business strategy, that the business plan is more mature, that people are, they need less hand-holding in the process of delivering a valuable product to their customers, be these patients directly, or to the providers, so to the patients indirectly, or the whole system. So I think that this is a great program that would benefit many, at the end of the day, many patients indirectly through all the people going through HITLab.
Fantastic. Yeah, I'm a big fan of the HITLab and the Breakthrough Alliance and what they do for the community. I know we only have a few minutes left, so one of the questions I do want to ask you is really for the audience is what advice would you maybe give the entrepreneurs and investors in the audience as they think about healthcare, not only from either creating a company or actually investing in a company?
First of all, it's all about the team, at least at the early stage. At the early stage, in other industries, even more so than in medical, because you'll see them pivot. I mean, we've seen COVID hit, and a lot of different companies had to shift gears, rethink, and go for a different direction. In medical, in general, in healthcare, I mean, you're not going to see as much pivoting on strategy, but you will see different go-to-market, different tactics, I mean, you want people who are creative thinkers, who are who know the market, who know the need. The Mongols had a great saying in the days of the Great Mongol Empire that an army of gazelles is more dangerous when led by a lion than an army of lions led by a gazelle. So let's see that there's a team of lions leading, that their timing is right. Why now? Can the startup answer the simple question of why now? And just saying COVID is not enough. What is it that makes the current timing unique for their opportunity? Then in digital, it's a lot about the market fit. Mm-hmm. It's super crowded out there. It's super crowded because everybody wants these days to sell to pharma, like insurance or their clinical studies, or post-clinical studies. They want to offer pharma the data science packages pretty much, and drug discovery and whatever. What makes you unique? What about your approach? So people come to me touting quantum computing, but that's a few years away. Mm-hmm. Now they come back and say, well, the NVIDIA GPUs are faster. Well, that's not quantum computing now, is that? That's classical computing. So there's got to be, a very clear value proposition that I'd like to see from these people.
Fantastic. Well, Dr. Dinstein, thank you so much for having taking the time to speak with me today. I really enjoyed the conversation, and I hope I get to work with you in the future. And with that, I'll hand it over to Stan.